Hello, this is an overview of coronavirus or COVID-19 for people with rare diseases. What is the coronavirus? Coronaviruses are a family of viruses that typically cause disease in animals but can jump to humans. The first human coronaviruses were identified in the 1960s as a cause for the common cold. And the coronavirus that is now causing infections in lots of people first started in China at the end of 2019, and it's believed it was transferred to humans from bats. COVID-19 has spread to nearly every country in the world, and it's been very difficult to control, partly because it behaves differently in different people. Some people will have a mild infection, and around 1 in 5 will have a severe infection and need to go to hospital. Out of every 100 people who are infected, between 1 and 3 will die, and older people seem to be at the highest risk. At the same time, it's thought that many people who have the infection may have no symptoms at all, and that makes it really difficult to control. It's very contagious through coughing, sneezing, and touching infected surfaces. And people can be affected very differently by the virus, but for many people it will cause a fever and a dry cough. For some people, it can cause severe breathing problems. Children can be affected very differently by the virus. They may have other symptoms such as a sore throat, or a runny nose, or vomiting, or diarrhea, or they may have no symptoms at all. If you have a rare genetic condition but you haven't received a letter to say that you're a high risk, does that mean you do not have to worry? No, not necessarily. It is very tricky to identify all the people who are at high risk of COVID-19. And unfortunately, some people who are at higher risk have not received a letter, and some people who probably aren't at higher risk have received a letter to say that they're at high risk. If you are unsure, we recommend that you look at info sheet 2 to work out whether you're at high risk. And if you think this may be the case, talk to your GP, your hospital doctor or nurse, who can give you more information. What can you do to protect yourself from COVID-19? There's still a lot that we don't know about the coronavirus, and we are learning new things every day. For now, there is no treatment or vaccine available, and so it's really important that we are all very careful with hygiene, as prevention is the best strategy. You can read more in the following sections. Section 2, what makes a person more vulnerable to COVID-19? Section 3, understanding your risk if you have a rare disease. Section 4, what should I do if I'm extremely vulnerable? Section 5, what to do if you have symptoms that could be due to COVID-19. And Section 6, advice about carers entering your home.